Hello, hi Sonia. Really happy that you joining us here. Yeah, you've been a patient, I think, about for about 8 years now, and yeah. So if you could share with us your history, I know that maybe starting back to childhood. I know you had a really difficult upbringing. Could you kind of share with us what your story is?
Yeah, so when I was younger, I grew up with a very kind of combined family. So, like, my mom's brothers were kind of involved in our childhood in quite a bit. And one of my uncles pretty much like abused us in very various forms, probably all the forms. And it caused a lot of trauma and like I forgot a lot about like what happened as a kid because I like just associated, kind of blacked it all out.
Oh,
And
yeah.
then when I first started seeing you, that's when I was getting a lot of like half memories and like a lot of flashbacks of stuff that had happened and it was triggering me quite a bit.
Yeah, I think you said your mom has had cerebral palsy and your dad worked a lot, and that so that's why you were raised by siblings. But so then I think your siblings also, right, involved in all that. So I think they probably shared similar problems, right?
Yeah, so I think you might have seen my brother for a little bit. I don't think my sister, but yeah, we all kind of experienced differently the abuse as a kid. It yeah, very differently between us, all three of us, just because I think it was just depending on where we messed up. And the punishments were always kind of different according to where we had messed up on, like whether it was homework not being prepared well or not being able to do a math question properly.
Really?
So yeah, I definitely I remember one day I could not for the life of me get this math question and my uncle was like screaming, yelling at me and well, eventually he got like a glass ruler and started like hitting it on my palm of the hand. So that those were like kind of the memories that I was getting flashbacks of and that's when I really did seek out help.
I think when I first saw you, I mean, you're seeing a therapist, both, and I know really well, is Colleen. I know, and I think she's the one that referred you to me initially.
She did.
So tell us, like, before you even saw her, when's the first time you ever got any kind of help? How old
So
were you?
yeah, so I was referred to from actually my brother. And so when I had sought out help, like I think our session was more than an hour and it was a lot of like opening up, crying, letting her know everything that happened and a lot of the unresolved issues and a lot of it I felt like I was struggling with wanting to remember what had happened. And especially with all the half memories I had, I was going back and forth of like what happened during these blackout moments and then me coming to again. And so that's when we started doing EMDR with Colleen. And I felt more than I saw like in my body. I didn't get clear answers of what happened. Just know like during those moments, it was just more abuse that was happening that I kind of just disassociated from.
Did you find EMDR at all helpful?
I did. There were moments of like understanding like why the left side of my shoulder always hurts because in the it was weird. Like one of the times that we did do EMDR, it felt like my face was being pushed against a bed and like my arm was being tugged behind me and like even now like my left shoulder kind of like feels funky so I don't know if like that has to contribute to anything but I did find EMDR very helpful. There were a few moments where it was very triggering more than helpful I would say. I think it was just depending on where my mind took me.
It's a difficult kind of therapy to go through because you have to relive it, some of it, and it's not easy. I know your brother. I think your brother had gone through the EMDR also.
Hmm.
So it's the best type of therapy for trauma, that
I
there is.
agree.
Available. But and I think when you saw Colleen, so had you been? I know you were with Kaiser then too. I know
Yes.
like we still are.
No,
Uh,
not anymore.
but that kind of gave us a little limitation on the medication choices. But
Yeah.
before you saw me, weren't you seeing? Were you seeing another doctor before that?
No, I think you were the first one to put me on medication.
Because I think there was there. I saw there was Lexapro and
I
um,
might have. I don't really remember. It could have I I'm trying to remember. It was like so long ago.
right.
Um,
'Cause that was
but
like that was you were like 20, yeah, 23 or something. I think you were like eight years ago.
yeah, so I definitely don't remember if I was on meds, but I know whatever we had tried together, um, it made a world of a difference for me.
Yeah, because I think you were having some suicidal ideation, and then I think you were cutting at one point, right?
Yeah.
And so yeah, I think by my notes, I think you were on Lexapro. I think it was before you saw me, and it helped a bit, but it didn't help a lot. And that's when Colleen had mentioned Pristique, which is my baby, basically. uh,
Yeah.
my top prescription that I prescribe, and I started you on it. You responded well to it, but then
Yes.
with trying to get medication through Kaiser, I think they switched you to Effexor XR, which is still good. I mean, it's very similar to Pristique. Actually, the same manufacturer that made Pristique made Effexor. Uh,
Okay.
so yeah. So can you share with us like your journey, because that was 8 years ago, along the way, with how you were doing then and how you did along the way.
Yeah, so once I started like titrating on the meds that you had given me, and like I know we experimented a few times with like the dosage, the type of medicine, and honestly, like right away I felt a huge difference, more energy. I know along the way we started adding meds depending on like what was happening, what was reoccurring, and like what was like kind of keeping me away from being to where I am now. I did, um, there was a period of time after I had seen Colleen where I didn't see a therapist, maybe for a year. And then I think that was mostly because I was kind of done with the childhood trauma and I was kind of ready to focus on like growing myself as a human and, or, yeah. But yeah, no, so from there with her and then along with the medicine that you had given me, I had gained a lot of like confidence within myself because with the trauma as a child, like it was always being called stupid or you're dumb, like you don't know what you're doing, like what's wrong with you. So it took a big toll on like my confidence and like just even the quality of like life for me. And with both, Colleen and my other therapist, like I had gotten the techniques to stay more confident with myself, be more present too. That was like the other thing that I struggled with a lot was just driving and disassociating, sitting here. And I would sometimes just, if I was listening to somebody, I'd just disassociate. And people are starting to notice when I would disassociate. So I've learned to be more present in those situations. And so, yeah, I know that we've talked a few times about like what was going on but definitely with the medications, I feel like I've very much leveled out and feel 10 times better than I was before.
Question I asked, I probably asked you the first visit, or you. I think when you fill out my form, you had to ask a question. I asked people when's the happiest you felt in your life, and the most common answer is childhood. Elementary school, especially. Before puberty, the life's supposed to be fun and playing with your friends. No really cares or worries in the world. That's a lot of people, but that wasn't your situation. So I think you had a hard time answering that question because you didn't really recall that time.
Yeah, there was probably like a few moments in my childhood where it felt happy, but I'll be honest, like for the most part, my happy moments were being in school and away from family.
Right? Yeah, yeah.
Yeah.
So yeah, so when you don't have that really good foundation it really makes things tough later.
Mhm.
because you don't really know. And a lot of people say I felt best in my late teens, early 20s. Part of it sometimes is just getting out of the house and getting the hell away, and
Yeah.
starting to like be on your own. And I know you've gone through like a really good education. I know you're an occupational therapist, which is not easy to get to, to get through grad school. But so you've done really well. But I think part of the problem is, your genetics.
Hmm.
So that's what causes a lot of these problems neurochemically in the system is genetics. Your brother, I don't know your parents, but I'm assuming, yeah, your parents, obviously, uncles and aunts have some major issues going on there.
Yeah.
Um, and then secondarily, going through puberty, that's the difficult, makes middle school difficult sometimes. Sometimes high school also, and then trauma, and you were exposed to trauma, so you really had like the setup for all this stuff happening.
Yeah.
And I think, like I said, I think I switched you from Lexpro to Effexor or Pristique
Hmm.
and Effexor, and then I think you were already on Wellbutrin
I think so.
time, and then I increased the dose of that, and then you were doing better, but then still you were kind of still not great yet. You were kind
Hmm.
of up and down a bit still. And so that's why I thought, we pretty much maximize the antidepressants. So I think it's time to move towards like a more like called mood stabilizers.
Yeah.
Not because you're, manic or any of that. It's just because of the fact when someone is depressed and just the simpler antidepressants aren't fully resolving it, that there's usually something else going on, and that's where the mood stabilizers come in. So that's the first one I did was with you was Abilify,
Yes,
which really helped quite a bit.
it did.
But even after Abilify, I knew there was a missing piece because you were saying better, but still not there. And people might say, well, you can't just keep throwing meds at the problem. You got to work on, counseling and all that. It's like, I understand that thinking, but my thinking is I want the best results for my patients. I want them to, and it doesn't matter if it's 3 or 4 medications or 1 or 2 or 6. That's not the point. People get all caught up in the number of medication thing.
Hmm.
It's the results I'm looking for. So the last piece I put in was Lamictal, amazing medication. It's an antidepressant that it's in its own class, works on GABA, not dopamine or serotonin, norepinephrine. So when I put Lamictal in, everything really steadied out for you. And ever since I put you on the Abilify and Lamictal, things have gone a lot better in my.
Oh yeah. The suicidal thoughts, like the fluctuation of like having, I call it the roller coaster of emotions,
Right,
whether like
right.
I'm better at catching myself when I'm going downhill with the mood. But yeah, it was a huge saver. I would say that for sure.
That's right, because I think even with the Effexor Wellbutrin, which is again I call the dynamic duo, it's my favorite combo, or Pristique Wellbutrin. You were better, but you were still kind of getting that roller coastery, like better, and then we're still kind of falling into depression, then you get better. So we call it like a cyclical depression. So
Okay.
when I see a cyclical depression like that, I know it's a deeper, tougher depression to get to tackle, and that's where the Abilify and Lamictal come in. And then since I think Abilify helped us, since Lamictal also, just things have been a lot more. I mean, not that we're not trying to prevent you from having emotions. People,
Yeah.
we don't want to flatten you out like Lexapro could do, like it did with you, where it kind of makes you feel flat and apathetic. We're looking for people that have normal emotions, but not like overkill, and so not responding appropriately to something and not over responding, so
Yeah.
yeah, because we still want you to feel like you want to be sad when you're supposed to be sad, you want to be able to be happy when you're supposed to be happy, and that's just normal human emotion. So
Yeah.
medications, if people are ever questioning these things, these aren't meant to do that, take away emotion. I look at them as a way to restore what's really ideal for your body, because all these are doing is balancing your chemicals. The period.
Hmm.
They're not adding things that aren't there. All they're simply doing is balancing chemicals that are already in your system that are out of balance for reasons you have no control over. There's nothing you could do about it. You couldn't outwish it or outthink it. You know, when it's a chemical thing and medical thing that like it is with you and many and so many of my patients, you know, that's why, you know, medications are so key. And again, I think the controversy is typically man-made. It's basically people who really don't understand this issue. And there's a lot of
Yeah.
people out there, a lot of influencers, a lot of podcasters. I could name a few that just are very anti-medication but they don't know what they're talking about. They have no
Yeah.
idea what they're doing. The fact that the damage they're causing, you know, giving that out message to people that you're weak or that you're, you know, if you know you're not as strong a person if you can't handle it, if you can't handle life, let's you know, it's ridiculous. But that's unfortunately what I deal with every day in my office trying to convince people sometimes who are really hard to convince that, you know, look, I can help you, but you need to let me help you. And
Yeah.
some people let me and some people don't.
Luckily, I was one of the ones that let you help me.
Yeah. So anything else you'd like to share?
Um, let's see. I had a night thought, but then it went away. Is there anything else? No, I definitely feel the world. There's like obviously like I was kind of anti-medicine at one point. Because I was like, I can fix it on my own. And obviously that only took me so far. And then but even with like my dad still, like, he's just like, you're addicted to these medications and like, just get off of it. You can be happy. You have nothing wrong with your life. Why do you need to take these meds? And it's so hard getting through um the benefit that these meds are doing. And I keep telling him, it's just like, do you remember how like angry and crying I was all the time? Like I was so emotional. Like I feel like now I'm more not necessarily like mellow or like, flat, but like more calm about approaching situations. And like, I think he sees a difference, but at the same time, it's just all like he disregards everything kind of that happened.
Yeah, and people struggle with that concept, like when to go off, when it's time, and I hear so many people say, "Well, things are doing really well in my life now. I think I want to go off them." And I try to talk them out of it, but some people you just have to sometimes do it to show them that you know that that you have a chemical thing. It's a chronic thing, and you know, like a lot of things we give in medicine, whether it be thyroid supplements or other things, or people have no problem taking supplements longer term at all.
Hmm.
But when it comes to these, people have this notion that they're bad for you, you're addicted to them, but you're not. It's impossible to be addicted to them. Well, how can I not be addicted to them? Because when I try stopping them, I feel terrible. Well, it's kind of like again a diabetic stopping their insulin, they feel terrible when they should be taking their insulin,
Yeah.
not stopping it. And it's similar. It's a very similar concept. But people, since there's no blood tests and people don't think it seems as real, people like your dad, you know, unfortunately, you give off that message and just you know you just have to ignore it and
Yeah.
realize that he's wrong and you know and just
Yeah. I just don't even argue with it,
yeah
argue about it at this point.
yeah right. So
Yeah.
um, I have a you know a patient I'll never forget. She did really well on a med. She tried to go off them like three different times on her own and it didn't go well. And she came in really upset, you know, and she said, well, you know things are going better. I don't understand why I have to keep taking these. And I explained to her. I go, look, do you remember what I did the diagrams I did with the chemicals and what these are doing? I said your body just doesn't balance these chemicals on its own. And he goes, well, you know, well, my opinion is that I don't think I should take these anymore. And I said, and I looked at her, I said, you know what, frankly, your body doesn't really care about your opinion. Um, and
Good point.
she,
Good point.
anyway, she said she left angry. I could tell she was not happy with what I said. I thought maybe I shouldn't have said that. And maybe I went a little far there, but I was upset. And um, anyway, so she said, she called me when she got home. She goes, I left your office. I was not happy. I was driving and I was like, and I was at a stoplight and I was like, and then I looked in the mirror and I looked at myself and I just started laughing. And she said, and I started realizing, why do I keep arguing with him? I obviously went to see him for a reason.
Hmm.
He would be right about what he says. He's right about every time I try going off him, it doesn't go well. Why do I keep fighting him? I don't understand why I keep doing this. And so she said, she got home, she called me She said, I just want to apologize about the attitude. I go, no problem. I said, I apologize if I offended you with what I said. And she's like, why don't we make a deal? Why don't you tell me when it's time to go out with them? I go, it's a deal. And you know what? It hasn't come up since then. We've had visits and she never asked. She's happy. She's doing great. But it took her trying to do it to prove it to herself. And some people, they have to do that, unfortunately, and so I've seen it many times. Now, it doesn't mean that some people can't, because there are some people that can be on things short term, like someone who's going through a really difficult grieving process, loss,
Hmm.
a very difficult loss, and they've never had any history before. Well, these are people that sometimes can be on things for 6 to 12 months, go off of them and be okay, or get past the grief, and they're okay. But when you have strong genetics, when you have to be on a combination of, like 4 things, the likelihood is less. But you know what? So what? I mean, they're not harming you. They're not addictive. They're not bad for your body. So, when
Yeah.
you get to that comfort level, like, what's the point? What's the point of worrying about it anymore? So, but yeah, but you're at a good place. Like I said, you've done really well in your career. Really proud of what you've done in your career. And so, but,
Mhm.
but yeah, but it's always a pleasure talking to you. And thank you so much for coming on the show.
Of course, I appreciate you, Dr. Corona.
Righty. Take care of yourself.
You too.
Talk soon.
All right. Bye.
Recording.
So in the case of Sonia, so she's got a mix of imbalances. So it took me a little bit to get the right combination, but not too long. She's been a patient for quite a while now. But she's done very well with Effexor. So again, the very first SNRI, because I've seen her for many years. So I started with an older product, but it's oldie but a goodie. And so that's working on serotonin and norepinephrine. Okay, so that gets those two moving the right way, connecting to the next cell, constantly moving through the system. Then I added a Wellbutrin, which I often will do. And that's working on dopamine mostly, a little bit norepinephrine, mostly dopamine. But they work. But that's why this mix is so good. Effexor Wellbutrin or Pristique Wellbutrin, because of that combination, really does a great job in those three. With her, it was different because she definitely, I detected there was definitely a bipolar element, not bipolar 1, but a more subtle variation, which is something I'm extremely sensitive to, because most doctors don't see that, and most doctors don't treat it properly. But when someone's on the dynamic duo and doing better like she was, but not to remission, which is the goal with every patient, get them completely better, there's something going on. So now I know it's time for mood stabilizers. So I put her on Abilify, which is a dopamine antagonist. So what we get with that is like we kind of filtering dopamine. So what we're doing is we're getting the benefits of the Wellbutrin, but then but it has to also we have to be slowed down sometimes. So it's slowing it down and speeding it up. So the point of it, we're trying to get a normal flow, not too fast, not too slow. Because once we get that proper flow, then we want it to go perfectly normal, and that's when I'm adjusting the dose to try to find out what that perfect spot is. So we got the best of both worlds. And then we weren't quite there yet with her. So then what I do often is add Lamictal. So when I detect a bipolar patient, she was a little more obvious than a subtle patient. She was definitely more obvious. Then I add Lamictal. So Lamictal is the only antidepressant that works on GABA. So now we got everything going. So I call the patient like her, I call her they're 4 out of 4. So what I identify is all 4 of the key neurochemicals are involved. And this is why it takes a combination of often with 4 different medications to do that. Sometimes it takes a little bit more than 4, but in her case, 4 does it, and she's been very stable on this combination and doing really well. So this is also really good. A little bit more complex of a case than the average case, but I love cases like this because once I solve them and I figure this puzzle out, then I love seeing the results.